Welcome to the Dr. Carolyn Coker-Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker-Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Hello, everyone. It's Dr. Carolyn Coker-Ross, and welcome to my podcast. Today, my special guest is Dr. Darria Long Gillespie. She is a Harvard and Yale-trained emergency room doctor and a clinical assistant professor at the University of Tennessee Erlanger in emergency medicine. Her ability to stay calm and take charge during chaos proved to be a valuable addition in the emergency room. Dr. Long Gillespie's expertise on topics such as Zika, Ebola, measles, women's health, parenting, and heart health has led her to appear on CNN, HLN, The Dr. Oz Show, The Doctors, and to speak regularly at health conferences across the country. But today we're going to talk about her newly released book, Mom Hacks. Welcome to the show, Daria.
Thank you so much, Carolyn. It's an honor. It's great to be back.
Yes, we did this before the book was released.
I know.
And I now have book in hand, and I've read it. It's actually a really wonderful book that I think will be a good resources for not just moms, though, but people who aren't moms, women in particular who aren't moms, who are doing too much and burning out.
I'm glad you brought that up because the book is very universal. Most of it works for everybody, whether you're a parent or not.
Yes, exactly. That's what I noticed. So tell me why you wrote the hacks. I know you had some health challenges on your own. Was that part of the journey that led you to write the book?
It really was, Carolyn. I started to notice as an ER doctor, I always kind of felt that, whatever comes through those doors, no matter how chaotic, I can handle it and that I've got this. But then in my own life, I became a patient. I developed an autoimmune arthritis and overnight really went from running several miles a day to being in so much pain, I couldn't really even stand up to see my patients. I'd pull up a garbage can to sit down next to them because there weren't enough chairs. And it was such a low point. And I started to realize, I have this, I've got this in my work, but not in my health. And I started to make major changes and really turned around my arthritis. So fast forward a couple of years, now I'm pregnant and I'm starting to get that same message of your health as you know it is going to change when you have children. It's out of your control. There's nothing you can do about it, which is kind of the same message I got when I had arthritis of this is out of your control. There's little you can do about it. And I knew I had solved it then. So I figured it's time to go back to work. How can I take those lessons I learned from my arthritis, plus that mentality that lets me feel confident in my work as an ER doctor to create a system so that I and every other woman out there can in our own lives feel like I've got this.
Yeah, I think that's a radical shift, and especially since as physicians and in medicine in general, patients are often told, you just have to accept this. This is the way your life is going to be. And what you're saying is, no, you can take back control of your life, at least to the best of your ability, and make needed changes that will really improve the quality of your life. So let's talk a little bit about what you call mommy brain, because I think all of us who are mothers probably know what that is, but explain it a little more.
So it is true. We all feel it. And it's a combination of just being exhausted and having so much going on. But truly also when you become a mother, your brain structure and some of the connectivity starts to alter as well. That's why women also notice a more hypervigilance, which in some of them comes across as anxiety. Others talk about this motherhood development as matrescence, saying it's just like adolescence. You got the hormones, you got the acne, you have the emotional roller coasters, and you're really developing someone new. And if you don't know to expect that, you can be like, what's happening? I'm losing my mind.
Yeah.
But we talk about, as I say in the book, this is normal. Know to accept it and kind of love the woman who starts to appear.
Yeah. What's the difference, though, between baby blues and postpartum depression, because many, many women suffer from postpartum depression and think that it is just that normal baby blues that occurs right after birth.
Yeah, I'm glad you mentioned that, because they say that approximately 80% of women suffer from baby blues, which makes me wonder about the other 20%, to be honest. I wonder if they were just too sleepy to answer the question. But then somewhere between 8 to 15% of that suffer from postpartum depression. So it's important to know the difference. Baby blues means that, occasionally on days you may feel more emotional, you may have some mood swings, anxiety, irritability, but they tend to kind of pop up and then they go away and they're not constant. Postpartum depression is a much more depressed mood. It lasts almost constantly. It's on most days. But again, I say these definitions as if they are black and white. So it's really important to all of moms to know that even if they're feeling baby blues, I'd like them to talk to their doctor about it. Because I know a lot of moms who said, well, I didn't really meet the questions for postpartum depression, so I said, no, I didn't feel that to my OBGYN. And I was like, no. If you feel remotely that way, talk to them, talk to somebody. It's important because especially for postpartum depression, if you don't get treatment for it, the symptoms can last to a year or more.
Yeah, and they can be pretty dark. I actually had postpartum depression with my third pregnancy, and I was surprised at how severe it is and how it changes your thoughts.
It truly does. And it has nothing to do with anything you did in good, bad mom, motherhood, nothing. Mm-hmm. So it's why I just tell everyone, like, this is me asking you. If nobody else asks you, I am implicitly asking you, and then please go seek out some help.
And there is help. There is something that can be done about it. It's not hopeless.
No, and there's many things that don't even require medications. Some women are afraid of going on medications. There's a lot of other things to help with PPD as well.
Yeah. What I liked about your book is some of the practical hacks you offered for nutrition, for example. And can you say why you felt nutrition was so important to include in here, and what are some of the hacks that you've put in
absolutely.
there?
So as you mentioned, there's 4 sections in the book. There's nutrition, exercise, sleep, and resilience, which is also kind of stress management. And for each of them, all of the hacks, since I'm an ER doctor, you're a physician yourself, so they had to be totally science-backed. But since I'm ER, I'm obsessed with time saving. So it was like science-backed meets the littlest, smallest effort you can make for the biggest change. So nutrition is so important because we know that what we eat impacts our health overall. It impacts our weight, but also it impacts our mental health. I mean, so many studies are showing that the Western diet significantly increases your risk of depression. As I'm sure you yourself know, this is nothing new to you. Increases your risk of depression by up to 40% over a Mediterranean diet. So I wanted to start with that and make sure that was in there to include nutrition.
Yeah. Give us an example of a nutrition hack, and why is it important to hack nutrition too?
Why is it important? So the reason it's important to hack nutrition for all of these is for most of us, if you look at how our caveman ancestors evolved, fat, sugar, and salt were scarce. So they didn't really need willpower to avoid them. They weren't there. They craved them. And so it was okay when they saw, fat, sugar, and salt. And you could never just find straight up sugar unless you found honey or maple syrup. There was no straight up sugar. That's the way our bodies evolved for thousands of years. Suddenly in the last 100 years, we are able to get sugar straight up. We are able to get foods with this combination of sugar, salt, and fat. And that's against a body that we don't have a strong willpower to fight it. So if all day long you are challenged with cookies and donuts and sweet kettle corn pop butter chips, your brain gets exhausted. You can't refuse it. You can no better refuse that than if I said, here's $10 million, hold your breath underwater for 15 minutes. Right. You can't do it. It doesn't matter how much you want to. So I created hacks, especially for nutrition, to say, what are ways that I can change my environment, change other things so that I'm not even challenging my willpower. That's what we see. People who we think have better willpower and lose more weight, it's not that they had more willpower. It's that they actually changed the situation so they were tempted less. So a couple of examples. There's some hacks in the book that are really tactile you can just do right now, and some are more conceptual. This is a tactile one. So I want everybody to do a little pantry intervention. Maybe it's a little KonMari of your pantry for your health. But what we found is, what several studies have found, is that, for instance, there was one study that found that if chocolate, M&Ms, if they were, everybody in behavioral sciences use M&Ms as testing for, so I don't know what that says about M&Ms. If they are right next to you versus if the M&Ms are 6 feet away such that you have to stand up out of your chair to go get them, or if they are up on a shelf such that you have to just pull a stool over, even if the stool is right there, you eat 70% less. And people reported no additional cravings.
Isn't that amazing, though?
Right? Isn't that crazy? Like, we like to think we are very intentional and very deliberate. And it's really monkey see, monkey eat, monkey no see, monkey no eat. Google had another one, a similar example. Their employees, they give away free food. Their employees were eating too many M&Ms. And so they took the M&Ms and they did not want to tell them not to eat it. They just took the M&Ms and they put them in opaque containers. And they put dried fruit and nuts and other healthier foods in clear containers. Over the next 7 weeks, their 2,000 employees ate 3 million fewer calories of M&Ms.
Wow, that's amazing.
So little changes, tiny changes.
And it really goes against that notion that we have to use willpower, because that's something that everybody thinks, oh, if I just had more willpower.
Throw that away.
Exactly. And I love the fact that you're giving really concrete things that actually work. That's really great.
Thank you.
I wanted to talk a little bit more about resilience. And you say that's, partly to do with stress, but is resilience a trait that we're born with, or is it something that we can develop or strengthen?
I am so glad you asked this, because if you had asked somebody 20 years ago, they probably would have said resilience, happiness, how you handle stress. All of those are based on your genetics and how you grow up. And there's really not much you can do. The brain doesn't change. We are learning that that is not the case. There's neuroplasticity, which means plasticity, the bendability and changeability of our brains. And there are a number of things we can do that I learned in this research that I do in my own life as well that really make a massive difference.
Yes.
A couple examples. Okay. Number one, so we hear a lot about, gratitude, be grateful. People who are grateful are happier or things. And I had heard that and I didn't think too much about it. But then I started to see some studies, some out of Harvard and different places. And they found that our brains are naturally wired to look for the negative. That's a survival feature from our caveman ancestors, when that shadow would probably mean it could be a tiger or a feuding warlord or somebody who's out to get us. So our brains look for the negative. They remember the negative. One way to change that, and one of the very few tools that we know can truly change your happiness set point, because we have a little set point, is gratitude. And one way to do that is this. So every night, write down 3 new things for which you're grateful. They have to be new, because here's what your brain starts to do. It starts to rewire so that every day, instead of seeing the negative, remember the negative, your brain literally starts to look for the positive, because it's looking for things to populate that list at night.
Oh.
So in 21 days, they were able to take people from being more pessimistic to make them optimistic, just doing this for 3 weeks. And that was astounding, because I never knew the science behind it and how powerful that was.
Yeah, that's amazing that it's such a short period of time to shift that. So you also talk about meditation. What's the place of meditation with resilience?
Yes. So meditation is another one of those where they have found that it actually changes the brain. And they took people, of course, they've been, MIT was actually studying monks, like from the Dalai Lama's team and all, which is kind of amazing, and looking at what their brains look like. I don't know about you, Carolyn, I can never hope that my brain is going to look like a monk's brain. I mean,
not unless you get a brain transplant. That's what I feel.
Yeah, exactly. Yeah,
That's what it would take.
So true. But what the study showed is they even looked at people like me and possibly you. I don't know if you meditate at all, but people who just did it, novices. And they found that after, just doing it for about an 8-week habit, when they looked at their brain, their amygdala, the amygdala is our anger, our fight portion of our brain, the size of their amygdala had decreased.
Which means they were more able to manage stress and less emotionally reactive, right?
Yes, less likely to have that, that monster bear jump out that we have when we start to get stressed or upset, which was fascinating. fascinating, especially in people who are not going and spending a year in an ashram. They are doing a meditation practice once a day, just like you and me.
Was it any period of time that they meditated? Was it?
I believe it was. They did a slightly longer one. I think theirs was between 30 minutes to an hour.
Okay.
So a little bit longer. I don't meditate for that long. I usually do like a 15 minutes. I have some Deepak Chopra meditations that I love, and Gabrielle Bernstein. I like both of them. I'll often pull them up. There's also a lot of apps, Headspace, Calm, that people can do and just try it. And it's really amazing. It's funny now that I kind of started doing it more regularly, I can tell if I've missed a couple of meditation sessions. Like, I got to get back. Like, this is getting bad. I need to start doing that again. So it's an ongoing thing. But I think I used to think, oh, it's a meditation practice. That's so much work. I'm not a person who meditates. All of us can do that. And you can incorporate prayer and your religion as well. 5-10 minutes even, you'll notice it makes a difference.
Yeah, I know that Catholics have the centering prayer, and that's a practice that's very meditative. And I think most religious traditions have some meditative practice involved. So, and it doesn't take much, even if you start with 10 minutes. Maybe it takes longer than 8 weeks, but even 10 minutes a day can help you feel better.
Absolutely. And even on that as well is mindfulness. I don't know, do you practice any mindfulness exercises yourself, Carolyn? You strike me as somebody who's very mindful.
Oh, thank you. Yes, I do practice a lot of mindfulness. And I actually did do transcendental meditation when I was in medical school, because, as you know, medical school is an extremely stressful experience.
Yeah.
And I credit TM for getting me through medical school, because it kept me from going off the rails.
Yeah. That's amazing. That's amazing. I've been wanting to try TM. I was talking to Sanjeev Chopra, who's Deepak Chopra's brother. And Sanjeev was trying to get me to do some transcendental. I'm like, I want to. I've got to get the book done. He's like, you can get the book done faster if you're doing transcendental meditation. I'm like, Sanjeev, I get it.
It's a chicken and egg thing,
I know. But also the mindfulness in general too, on those times when I'm out walking with my children or things and maybe don't have exactly the time to meditate, to be mindful and to have what I call phone-free time, where you just, whether it's going to the bathroom, because let's be honest, everybody pulls out their phone in the bathroom, or you're standing in line at the grocery store, all those places we start to pull out our phone.
What did we do before we had phones?
You know what? We actually had to talk to people. Crazy. But so I really do. I take that time and I just intentionally and deliberately do not pull out my phone. Or if I'm interacting with my children, I put away the phone. The phone's away and I don't look at it. If it rings, of course, I answer it. But usually it's going to be a family member or something. And to intentionally do that, because otherwise we're constantly bombarding our brain with more little facts and little things to be thinking about, taking us out of the present moment, which increases our stress levels and increases our distraction habit of our brain. So phone-free time every day, even if it's 2 or 3 minutes, keep it in the purse or keep it aside.
Yeah, that's what's called presence. And Eckhart Tolle talks about being in the now. And I think it's something that we're losing in our society. But I love the fact that we're now combining the digital world with mindfulness through some of the apps. You mentioned Calm, which I really like, and has different exercises that you can do. And there are so many others. So if you want to use your phone, at least take it out and do some of those breathing exercises.
Yes.
Listen to calming music for 5 minutes to get yourself off the ceiling. So let's just shift to talking a little bit about exhaustion. And I know that's, something that as a mom, most of us have dealt with, but also just in the busy working, overworking world that we live in. I think many people are dealing with exhaustion and even burnout. What are the hacks for that?
So, yes. And that's initially why I wanted to write this book, because I was struggling with that. And I really think it showed itself in the terms of my arthritis. It happened when I was in the middle of residency working 36-hour shifts. And I do find that when my sleep is off or I work an overnight shift or something, my arthritis flares up. And I really think that was my body saying, hey, you're not paying attention to how bad you feel. We're going to physically make you feel and notice this. Mm-hmm. And I think that was a sign from my body. So a couple of different things. Of course, there is a whole section on getting sleep, which is additionally a challenge for women in general. Women in general suffer more from insomnia than men. So I talk about kind of two factors for moms. There's how to get your kids to sleep, because even if you're ready to sleep, if your munchkin's wide awake, you're not going to be sleeping. So there's a lot in there about getting your children to sleep. And then there's a lot in there about helping you sleep. And that includes things like getting our circadian rhythm back on track. For so many of us, our body clock is just whiplashed because we get up at different times every day. We're watching Netflix till midnight, and our body clock does not know what time it is. That feels bad, feels like we have low energy, but it also impacts our health. A study out of Harvard showed that it took a group of people, and for 9 days, all they did was mess with their sleep. They woke them up at 10 p.m., then 2 a.m., and different things. After 9 days, they all had increase in inflammatory markers, increase in cholesterol and blood pressure, and a third of them would have tested positive for pre-diabetes, Carolyn.
Wow. Yeah.
From sleep alone.
Well, and also weight, because women are more interested in their weight than almost anything else.
Yes. And I understand that. And also studies show that if you take two groups of women who eat the exact same caloric intake, if one of them has higher chronic stress, that group has larger waist circumference. Yes. So there is some connection. We know bits and pieces of it. We don't have the full picture of high stress that causes us to crave even more high sugar, salt, and fat foods, which then progressively get stored in our belly, particularly in their abdominal fats, that extra spare tire. So there's a lot about stress in there. Another thing for moms, I think, and women in general, is the multitasking. We just talked a little bit about it, but I think multitasking truly contributes to this exhaustion and this sense of distraction. And we think we're really good at multitasking, especially us physicians and us ER doctors. But studies show that it doubles your rate of error and cuts your productivity by 40%. So again, I tell people to single task, focus on one task for 5, 10, 30 minutes, whatever it is. You'll do it more quickly and efficiently, and it just frees your brain a little bit, because that is the problem. Our brains are just being bombarded too much. How can you take off some of the workload from them?
Yeah, that's wonderful. I love that. I wanted to just end up with talking about something kind of fun.
Okay, I love fun.
Well, that's good. You in your book talk about the exercise personality. What is that?
Okay, so this was fascinating. So remember I told you when I was doing research for this, I was like, what are the easiest ways, the best scientific shortcuts that I can find to help make it easier for people to exercise? So I came across some studies that showed that using really your Myers-Briggs personality type, they can predict what exercises you will stick with better, which I thought was fascinating that you could predict that. So, and there's a whole table in the book of if you're extroverted or if you're the creative type or what you can do and which sort of exercises predict what you'll stick with most. Because what we know and what I tell people, if you hate to run, please don't run. Please do not get on the treadmill. I don't want you to, because if you're miserable, maybe I can get you to exercise for 3 weeks, but at the end, you're not going to keep doing it. And that does you no good. And that doesn't mean I've done my job. So I tell people, go to this table. Some people will be surprised. People who are creative type tend to thrive more in outdoor exercise settings, while those who are more intuition driven need more variability and a little bit of high risk. So then, people who are more intuition type tend to get bored with exercise. So know that's going to happen and kind of say, how can maybe those people should have a class pass or something so they can try different classes. So it's just kind of amazing. So how can you work with your body?
Yeah, and it's really a great notion to be able to work with your body instead of trying to whip your body into shape.
No, exactly. And that's what the hacks fall into categories. Like, how can I work with my body cycle so that no decisions are necessary? Or how can I change my environment to make the automatic decision, the unconscious one, the healthy one? That now I freed up brain space for the third category, which is helping you be intentional with how you're using your attention.
Yeah, and the bottom line is when you change behaviors, the most important thing is to be able to sustain and maintain those behavior changes. So if you work with your body, you're more likely, as you're saying in the book, to be able to keep it going rather than going on these big diet pushes or exercise pushes that don't work for you.
They fail. And then you feel badly as if you're the failure. And it's like, no, you're not the problem. You followed some trendy piece of expert advice that really wasn't an expert and was really just setting yourself up for failure. So I want people to know, that's why I want them to start small, because if you start small enough, you can achieve it. Then you feel good. And then you can pick up other hacks. But I really want people to start with one hack. Just do that. Feel good. Let me know how they do. I can cheer them on. I love cheering people on. And you get that self-acknowledgement, that self-reinforcement. I can do this, and I've got this. And then you go for further.
Well, thanks so much for being back on the podcast. And Dr. Daria's book is called Mom Hacks, 100 plus science-backed shortcuts to reclaim your body, raise awesome kids, and be unstoppable. And again, I just want to say, having read the book, that it's a great book for everybody. You don't have to be a mom to benefit from her hacks.
Thank you. And just on that, it's right now ranking one of the top bestsellers in women's health, general women's health. So anybody listening, if we can keep it up there, I'm really excited about that.
Yeah, so go get Mom Hacks and start hacking your own life, and tell us more about how people can reach you or learn more about you.
Yes. So the easy thing is I'm at Dr. Darria. So DRDARRIA. That's everywhere. That's on Instagram, Facebook, Twitter, and that's even my website is DRDARRIA. There's 2 R's in Daria, drdaria.com. I love to hear from people. I love to know what they're working on and what hacks worked for them, or what they want hacks on that I can go try to find a solution for them.
For your next book.
Yeah, exactly.
Okay, Daria, so great to have you on. I appreciate you coming back.
Thank you, Carolyn. Have a wonderful day.
You too.
Take care. Bye-bye.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit CarolynRossMD.com. That's CarolynRossMD.com to access podcasts, show archives, and more about Dr. Ross and her services.